mRNA vaccines. If you've been paying attention to the world around in the last few years, you've definitely heard that term before. That's the stuff I get jabbed into my arm to stop COVID-19 from pushing me around, right? Well, it's no secret that mRNA vaccine technology can be used in infectious disease prevention. But what people may be less aware of is just how useful this technology can be in helping treat non-infectious disease using non-immunogenic routes of action. In limb ischemia and diabetes ulcer patients, inadequate blood flow to tissues can impede healing and even cause cell death. Vascular endothelial growth factor A, or VEGF-A, is a protein that has been shown to cause angiogenesis and vascularization in tissues which it is expressed. Scientists made an mRNA strand that has been optimized for VEGF expression and called it AZD8601. Non-invasive imaging showed that even after a single injection of naked AZD8601 using a citrate saline buffer into mice ears, vascularization dramatically increased in 7 to 14 days. Sequential dosing increases effect even more and for prolonged periods. Increasing vessels is great and all, but does this effect carry over to wound healing? This was tested, and it was found that AZD8601 was able to increase the rate at which wounds healed in diabetic mice models when injected multiple times. A different team of scientists decided to test AZD8601's healing powers on pig hearts that suffer full occlusion myocardial infarctions. That's when blood vessels that feed into the heart itself become fully blocked. Without oxygenated blood flowing to the heart tissue, it starts to die and becomes unable to work. It was found that AZD8601 was able to positively impact ventricular function after a week. Dissecting the hearts themselves showed that the long-term effects of AZD8601 also included attenuated fibrosis and improved systolic function. So, what do mRNA therapies have that other treatments don't? Well, mRNA's in vitro manufacturing methods are easily scalable, allowing us to pump out large amounts for relatively cheap. All you need to do is produce mass amounts of mRNA using a template strand and RNA polymerase, add the 5' cap, purify it, and combine it with a delivery system. With efficient production and clinical effectiveness, AZD8601 shows lots of potential as an mRNA therapy for improving healing in ischemia and diabetic wounded patients.